Hello everyone, this is Dr. Mandar Malvade. I'm an associate professor from Krishna College of Physiotherapy, Krishna Institute of Medical Sciences, Karad, Maharashtra. First of all, I'm very much thankful to Dr. Khatri sir for giving me an opportunity to be a speaker for the conference. And today I'll be discussing with you problem-based learning, and I'll be giving you a gist of that, how you can implement a problem-based learning in your class in a small group, and what will be the outcomes of that. So let's start. Problem-based learning is an approach to learning revolving around a problem. It is based on two approaches. The one is that the problem solving skills are more important than memory skills, and learning through problem solving is more effective than memory based on learning. It was first introduced in medical education in McMaster University in 1969 on an assumption that lecture was not the most satisfactory means of providing learning environment. It was also felt that basic sciences need not necessarily come before the clinical sciences. And that is why when we compare the traditional learning to problem-based learning, we can find out there are many differences which you can see in every teaching methodology. Here, as you can see, in traditional learning, the focus is more on teaching that what exactly a teacher want to say. Whereas in problem-based learning, the focus is more on learning that how much amount of knowledge is gained by the student. The traditional learning always encourages a competition that, okay, fine, one person gets another 1 mark and another person gets other score, then how I can improve and I can get beyond the other person. So the competition is encouraged in traditional learning, whereas problem-based learning involves and try to encourage the students to join together and cooperate with each other to solve the problem. There are very few learning events which you can see in the traditional learning, whereas in problem-based learning there is wide range of learning events which you can see through the various studies which are approached by the students to solve the problem. Traditional learning is always a subject-oriented topic, whereas the problem-based learning is situation-oriented. We will discuss on that in next slide. It involves information mastery. You need to understand, you need to know when you learn through the traditional learning, whereas in problem-based learning, you try to gather the knowledge and you try to manage the information on the basis of the problem which is needed to be solved. Here, the faculty role is based on the lecture, whereas in problem-based learning, the faculty plays many roles such as a tutor, an advisor, a resource person, etc. So how to start with the problem-based learning? How you can work on by having a problem to be solved. But obvious, when you think about a problem-based learning, you need to have a problem. What is problem? It's a description of phenomena or events or a clinical scenario which we needed to be solved. Also, out of that, you need to have a tutorial group which is helpful in analysis of problem under the guidance of a tutor. The learning objectives are the concrete goals for study defined by the group, and the self-study in a library or home using multiple resources. Once you do this all, then there is an integration and application to check understanding and proficiency of the problem, and you try to solve it. The problem is meant primarily to generate some learning issues. It is a driving force behind the student's learning. So when you think about a problem, it has structure. It should consist of a title, which helps to guide a student in a particular direction. A trigger material or a story, a description of a phenomenon or an event, and instructions which indicate what action to undertake. So let's take an example. So when you think about a problem, like a patient is coming to you and you are trying to find out what is the problem for the patient. Supposedly the patient is coming with a simple palsy and the patient is walking with a slouch and a little bit of bent knee and a hip and the foot. So the title for the problem would be a patient is not able to stand straight. That is the title for the problem, inability to stand straight. So we need to find out a story behind that. What exactly is the description of that trigger material? What could be the reason? It could be cerebral palsy. It could be because of the shortening of the soft tissue. It because of the spasticity. It could be because of the tightness in the muscles. So that could be a trigger material. And the instructions that what action to undertake. That means that to solve the problem, what are the things you need to go through? So every problem should have these 3 points. That is a title, a trigger material, and instructions to follow so that you will have a complete structured problem with you. When you think about a problem characteristics, it should consist of a neutral description of a phenomenon. Like I said, inability to stand straight. It should be formulated in a concrete terms. Inability to stand straight. A concrete term which is going to be helpful to understand what exactly and a clear idea about the problem. It should be quite short and there should be a direct learning into limited number of issues. There should be a complex thing like a patient has a bent shoulders, kyphotic posture, knees are absolutely 90 degree beyond 90 degree. Then a patient is having a low gaze. No, 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 no. There should be a limited number of issues which should be explained in a problem. Inability to stand straight, and there should not be issues that do not lend themselves to hypothesizing based on prior knowledge. A problem should be written on the edge of a prior knowledge and should therefore indicate gaps in what the students know at present, meaning that there shouldn't be too many distractions. A person or a student should understand that okay, fine, there is a posture where I need to work on with. There is a patient who is coming to me and having a problem that it is inability to stand erect. That's all. There shouldn't be so many things to go for distraction that okay, then what is the patient having a gait, what could be the patient's sitting posture, what could be the patient's any other genetic issue or something like that. No, there should not be any distraction. There should be a complete concrete term with limited number of issue and a descriptive phenomena without any distraction about a problem. A patient is not able to stand straight. Like an ICF model, every problem can be classified as a pathological and normal functioning. They can also be written in different levels of organism, like cell level, tissue level, organ systems level, person level, family level, and community level. While the person level problems are the easiest to write, we need to ensure that as far as possible, we cover the whole range of levels in our problems for each block. Let's start with the cell level. Let's take the same example. The person is not able to stand erect. So when you think about cell level, you can try to analyze, you try to solve the problem, try to find out the problem could be at the cell level. The muscles may be having an issue in the metabolism. Maybe the channels of the calcium and iron gated channels may are defective. So that is at the cell level. When you think about a tissue level, there are chances that maybe the neuromuscular junction is affected. Maybe Golgi tendon organ has an issue. When you think about an organ system level, you try to analyze why the patient is not standing erect. Maybe there are chances that the limbs are involved, the joints are involved because of the muscle shortening, because of the muscle tightness, because of the muscle spasticity. In tissue level, the knee joint, the hip joint is affected. Maybe at the person level, if you can see, the patient may have a habit of trying to maintain the COG at the ground level, is bending forward to maintain the right and left balance. At the family level, there are chances that the patient might be getting a lot of support from the family, that they are not encouraging him to stand erect. And at the community level, maybe there are chances that the patient may landing up to have this posture because there is already a weakness. Along with that, the community is not accepting, which is landing him to having to cope up in the community level issues. So when you think about any problem, the varieties and the variables you need to try to analyze, and you need to find out where could be, at what level could be the problem, and it could be cell level, at the tissue level, at the organ systems, at the person, at the family, at the community. You need to try to find out where the problem could be, and then on the basis of that you try to get the solution for this problem. So far we have discussed that how exactly a problem could be, what are the varieties, what are the characteristics of the problem, and then you try to come up with the solution for the problem. So far we have discussed about what exactly is the problem, what are the variables of the problem. So let's start. When you try to use problem-based learning in a class, how exactly you can work on, how you can have students involved through problem-based learning. In the first meeting, a group should select a group leader who will coordinate that session's activities. It will be the group leader's responsibility to try to involve all members of the group in the discussion, as well as to ensure that no one member monopolizes the discussion. Out of the group, there should be one person who could be called as a scribe, who can try to write down the points which are mentioned by the other group members. The script and the group leader should always be a rotating position among the members, so that everyone will have a chance and everyone will have an opportunity to express as well as present themselves as a group leader either or a script. According to the literature, it is a 7-step approach in a problem-based learning. What are those? The first thing in the first session will be to clarify any unfamiliar terms and concepts which are related to the problems, such as a patient cannot stand erect. So, is there any unfamiliar term? Can a student decipher what does that mean? Secondly, you need to define the problem or the issues, that a group decides the statements or the items or information in the problem that require the explanation. Why the patient is not able to stand erect? What exactly is the erect posture meaning? What are the pathological features behind patient's not erect posture? So the patients start to define the problems or the issues in a first session. Secondly, you try to analyze the issues which are identified. Discuss the the hypothesis, and the group members' view should be explaining towards the issue which is to be analyzed. Once you analyze the problem, there will be a summarization of the discussion and make a systematic inventory of the explanations. That what could be the reason, what are the problems, what is the reason behind a patient having a bent posture. Once you try to summarize it, then you should be instructing to the students to decide what new information is required to deal with the problem. Prioritize and agree on learning objectives to be pursued by all members and by which the individuals. And then you pursue the learning objectives individually or together. You try to go and analyze, unlike textbooks or the journals or AV material or net, you try to pursue the more knowledge related to the bent over posture. In a second section or a second session, you again come back and synthesize the new information and agree on whether the items identified are explained to the satisfaction of all members. If not, again try to review what exactly what you have decided. Again try to summarize and decide what you need to find out, and then again you try to study the problem. When you begin a new problem, if the group is satisfied and the solutions of the previous problems are achieved. So let's take over what are the roles of the each person in a group. That is a group leader, a script, and a group member. Being a group leader, there is a responsibility of keeping the discussion goal oriented. There shouldn't be a distracted discussion going around regarding the problem. You should always, a group leader should always guide the problem-based learning steps, the 7 steps which we have discussed earlier. Clarify and steering the discussion is the main thing which a group leader should do. A discussion should be always goal oriented. It should be steered towards the goal, that what is the problem, how to solve it. Always a group leader should stimulate the participant. Okay, what do you think? What do you think? Just think more. Can you think in the out of box? Something like that. Always he should guide the documentation. He should be a motivator. They should try to indulge all the participants equally and try to complete the record, and there should be a timekeeper as a role for the group leader. A discussion is going on continuously for a long period of time. There shouldn't be. It should be specific, task specific, it should be limited, and it should be steering towards the goal, not haphazardly anywhere. When you think about a script, the script should always make clean and short notes. A contribution of the group should be registered by a script. A summarization of the information on the day or on the session is the script's responsibility. There should be an external memory which is carried out by the script, and he should not be selective. He or she should not be selective. He should think as an external memory. He should not partake into the group where discussion is going on. He should always give an equal weightage to every participant, to the every thing or a thought produced by the group members. And the important people are the group members. A group leader and a script will only be functioning until unless there will be an action carried out by a group members. There should be active participation, active listening, asking questions, answering questions, giving information and make decisions. These are the roles which are mainly carried out by a group member. There should always be an involvement of every person in a group, and then only it is possible to achieve the problem solving goal as well as the problem solving learning. This methodology only will work when all people in a group will work together hand in hand and try to discuss and analyze the thing with using all the thoughts as a one brain together, guided by a group leader and documented by a script. During problem-based learning, there are few difficulties which are perceived by the students. They are associated with the process of study, they are associated with the problem, and they might be are associated with the resources. So what are those? In the processing, the student may feel that there are too many objectives which are covered by the group, and this didn't allow enough time for individual study to cover all the objectives. The basic objectives should be covered by the entire group and specialized objectives delegated to the individual with special interests. The narrowing down objectives is difficult in the small group setting since some students may have advanced in their studies. So these are the problems or difficulties which are found by the students during the process. Regarding the problem, the students also complain that they do not know the depth and extent of the information required. Too much work to cover too little time, and more detailed information should be supplied in the problem. Whereas with the resources, the student also find that library resources are difficult to obtain, resource personnel is not available, and lack of audiovisual aid is disheartening. So these are the few difficulties which students may perceive when they try to learn through problem-based learning. So what is the tutor's role when a students find difficulties through problem-based learning? As I told you earlier, a faculty plays several roles such as tutor, advisor, a resource person. A tutor in this session is to facilitate a learning process. There should be a stimulation given by a tutor to cooperative behavior and to monitor the individuals and the group's progress in acquiring appropriate knowledge and reasoning skills. He is also responsible for planning group in contacting resource personnel. A tutor should encourage the analysis and synthesis and evaluation of the data. The student should restart reasoning and give comments and statements which are encouraged by the teacher. A tutor should also intervene when indicated to keep discussion on track and stimulate thinking. So whenever the session is going on, you should give them a direction by asking questions such as if there is a patient is having a problem, like I said, erect posture, not no erect posture, or a bent over posture. So if somebody comes up with there might be chances that there is spasticity. So you should give them a way that what do you think that the spasticity may be coming up? Or what could be the reason a patient will have a spasticity? Where do you think the spasticity will come into picture at the earlier stage? So by giving them a question or by asking them a question, you can facilitate their way of thinking towards this problem solving. Supposedly, if the group discussion is going on and the students are a little bit diverted against question and it goes like far away from the problem solving, then a tutor or a faculty should get the steer and they should try to give way towards the discussion rather than going beyond and having a out of problem solving issue discussions. So these are the way a tutor should follow the problem-based learning. So far we have discussed about the problem-based learning, that what exactly it is, what are the problems, what is the actual characteristic of a problem, and how you can work on in a classroom with a group of students to work on with the problem-based learning. I hope I have covered a few of the points in a problem-based learning, and I hope you have understood what exactly I mean to teach for the today's session. Thank you. Thank you so much. Have a nice day.